On July 7th, Grenadian health officials reported that they were actively monitoring an outbreak of conjunctivitis in the region. At that time, the number of cases in Grenada were considered very low and was not a cause for concern based on regional and international standards. However, according to senior medical officer Dr. Francis Martin, to date there has been an increase in the number of recorded cases of conjunctivitis in Grenada.
Let's say conjunctivitis is something that we've been monitoring and is one of our surveillance points at the Ministry of Health. From January to June, January to August of this year, the total amount of red eye was about 40 something in the whole year. However, last week we noticed, and coming into this week, we noticed a drastic increase. Currently it's about 90 something, almost 100 cases, and those are just documented cases in the public facilities. We're not talking about private facilities and private offices. So I have reasons to believe that we may be close to 100 or over 100 cases in just 1 week's time space, and so that's why we really believe it's an issue that we must speak about.
Dr. Francis Martin, in speaking to GBN, indicated that the current outbreak is viral and can be transmitted by person to person.
It's important for persons to understand that this is transmitted from person to person merely by touching hands or not washing their hands. So it's really important that persons wash your hands and don't touch your eyes, because someone may have it and handle something. Even things as simple as doorknobs and money. Persons may go to the toilet, washrooms, and they leave the virus on the doorknob. And you touch the doorknob and you yourself can get it by touching your eyes. So it's really critical that persons wash their hands, keep it clean.
Dr. Francis Martin outlined some of the most common symptoms of the disease.
Symptoms of pink eye or red eye, as the name suggests, is actually reddening of the eye, some of the conjunctiva of the eye, the white part of the eye, so to speak. Persons may also experience burning, itching, pain. The eye may tear a little bit or water a little bit more than normal. Not necessarily any problems from vision standpoint. You should be able to see okay. It's just that you would get pain and swelling and red and running eyes and so on.
Ladies are being advised to refrain from sharing eye makeup, as this too can cause persons to become susceptible to the disease. Akisha Felix for GBN.